We have now detected 68 variant cases in the province. Unfortunately, out of the 11 new confirmed variant cases yesterday, all of which are B117, or the strain first identified in the UK, 7 of these currently have no known link to travel. Investigation is underway with detailed follow-up of all these cases and their contacts. 2 of the new cases, which are travel-related, have been identified as having potentially exposed 2 additional schools in the Calgary zone. As I mentioned in previous updates, these individuals did nothing wrong, and unfortunately, the exposure was the result of a overlap in incubation and quarantine periods. In the schools that we identified exposures in earlier this week, I am happy to report that there has still been no spread detected within any of these classes despite enhanced testing. However, with these 2 new schools, as before, it is important to know that anyone who may have been exposed was already quarantined after the initial COVID positive test. We are now offering all close contacts the chance to get tested twice as a precautionary measure. We are actively reviewing the literature and experience around the globe to assess if additional measures are needed in schools and other settings in the weeks ahead. Evidence is still emerging, but we are watching closely. If we need to make changes, we will do so. The reason that these new variants are of concern is because of their increased potential for spread. So when we're able to identify them, we can put interventions in place to prevent that from happening. And again, we have seen in several places that while we've identified the variant, we have not seen further spread onward because of the interventions that are in place. So we don't have a set number or threshold for number of variant cases that would impact our decisions with respect to taking the next step forward that would happen on Monday. What we are watching closely is whether or not we are seeing an increased transmission rate. That has not happened. Our numbers remain very small of the variants, and it is a good thing that we're identifying these particular cases so that we can prevent them from spreading further, and so that we can ensure that we know exactly what our current situation is. The variant cases still represent a very, very small proportion of our cases, and by finding out about them, again, then we have the means to do something to prevent any kind of onward spread. Yesterday, we completed more than 11,500 tests, and our positivity rate is currently about 3.6%. Looking to schools, there are currently active alerts or outbreaks in 304 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 763 cases. We continue to see a decline in our hospitalizations, which benefits every Albertan. There are currently 517 people in hospital, including 93 in the ICU. Sadly, 13 new deaths were reported to Alberta Health over the last 24 hours. My condolences go to the family and friends of these Albertans. We can never forget that these numbers represent human lives lost. These aren't just statistics. These were people who leave behind grieving family members, co-workers, friends, neighbors, and community members. All of our efforts are to limit the spread of COVID-19 and in turn to help more families from going through the pain of having a loved one in hospital, in ICU, or tragically losing a loved one to this virus.